The previous modules introduced basic information about influenza viruses and concepts that are used in the surveillance of disease outbreaks. This final module will introduce a new method of surveillance known as active observational surveillance, or AOS. AOS relies on detailed, consistent observation and record-keeping of both abnormal and normal animal conditions to detect and identify possible cases of disease. The data collected in this process can trigger further investigation, reporting, and rapid management. The concepts of AOS have been in place within the domestic poultry industry and are ideally suited for use in the exotic animal community. Zoological facilities already observe their animals regularly. Use of AOS within zoological facilities simply standardizes these observations and their use. AOS does not require new equipment, software, or additional technical training. The primary elements of an effective active observational surveillance system are the routine observations of animals and standardized consistent record-keeping. In order to be effective at detecting possible disease outbreaks, there are key elements that must be part of any AOS system. To explain these key elements, we will answer the following questions. What types of observations are involved in AOS? When should these observations be made? Who is responsible for these observations? Why are regular, consistent observations and recordings important? And finally, how does this process of data collection help detect and identify possible outbreaks? For AOS to be effective, it is necessary to establish what specific observations will be recorded and how that information will be recorded. Although animals commonly hide signs of illness and many collection animals are not handled unless absolutely necessary, there are easy and routine observations that can be made which could indicate a health problem. These observations might include activity levels, food and water consumption, body and coat condition, environmental conditions, and mortality for exhibits with numerous animals. Observation should be recorded at pre-planned scheduled times. This should be part of a daily routine. Individual animals, herds, or flocks should be observed at least once a day, at the same time every day. Individuals responsible for taking observations may vary across facilities and may include animal keepers and veterinary team members, as well as other staff and volunteers. It is the responsibility of those taking observations to ensure that data is collected according to schedule in a standard format. Each observer should understand that these tasks are part of the overall care of the animal. Developing standardized protocols will help create reliable observations across all animal observers. It is important to understand why consistent observations and record-keeping are essential to AOS. Remember, consistent recording of normal observations are as important as recording abnormal observations. Normal observations establish baseline patterns of health for an animal or group of animals. A baseline pattern indicates the typical or average health status of animals over time and may include chronic ailments or mortality. For example, if a flock of birds is recorded as having an average of 1% mortality a month over an extended period of time, this would be considered a baseline pattern. Inconsistencies in observations or the absence of recorded data can lead to inaccurate baselines and may cause abnormal conditions to be overlooked. Careful review of baseline patterns is how AOS is able to detect and identify potential disease outbreaks. This information should be shared and discussed among all animal care team members and attending veterinarians. Changes in a baseline or other unusual findings may indicate disease and should trigger a planned response. If the same flock from the earlier example with a baseline of 1% mortality a month now experiences 5% mortality in a given month, this may indicate a disease outbreak, and further action should be taken to confirm and manage the potential threat. Active observational surveillance is a good first step in an institution's ability to detect a disease outbreak and should always be followed up by proper investigation, reporting, and management. AOS is a tested system, is cost-effective, and builds upon a zoological facility's already established practices. Know the what, when, who, why, and how of active observational surveillance to effectively protect your collection. Throughout history, animal and human populations have been impacted by viruses. Jumping from animal to animal, species to species, viruses thrive on contact between organisms. To help prevent viruses from being introduced to your animal facility, you should know the risk factors associated with transmission, such as close contact with infected people or animals. Careful observation for clinical signs of infection and the use of surveillance methods can be effective at detecting if a virus has been introduced. If an infection is suspected, remember the 3 elements of surveillance: investigation to confirm cases, reporting to help identify trends, track diseases, and allow for rapid response, and management to control the spread of the disease. As always, personal protective equipment should be used whenever working around animals or enclosures to protect both staff and animals from infection. Every member of an animal facility plays a critical role in the health of animals and staff. Understand the concepts presented in these modules and how you can apply them to help detect, manage, and even prevent the introduction of foreign animal diseases. Communicating and working as a team will help ensure a safe and healthy animal facility.